Hey there, podcast listeners. Thank you so much for being here with me today. In this episode, we delve into quantum resonance medicine with the brilliant Dr. Lonnie Herman. Renowned for his groundbreaking rapid health restoration system, Dr. Herman combines expertise in neurology, endocrinology, and autoimmune diseases to offer a cutting-edge approach to healing. We'll talk about the profound journey that led Dr. Herman to develop this system and his dedication to helping individuals suffering from a variety of chronic and debilitating diseases. From the intricacies of quantum resonance to personalized protocols, we explore how the rapid health restoration system uncovers and eradicates root causes of all kinds of conditions. Dr. Herman's passion for restoring hope shines through as he shares many patient success stories and the transformative impact his unique approach has on women's health conditions like endometriosis, heavy bleeding, UTIs, chronic vaginitis, and more. If you've struggled with chronic conditions for a long time, this conversation could change the way you view your well-being. If you want to share this episode, tag at Dr. Lonnie Talks and me at Nicole M. Jardim on Instagram and let us know what you thought about the episode. And of course, don't forget to leave a review or rating on Apple Podcasts or Spotify. As always, thank you so much for being here with me every week. I truly could not do this without you and your support, and I am super grateful for you being here and listening to this episode. Enjoy. Hi, Lonnie. Thank you so much for being on the podcast with me today.
Thank you for having me on. I really appreciate this opportunity.
Yes, absolutely. I have been so fascinated reading through your website, and I can't wait to get into all of this stuff about a quantum. What is it? Quantum resonance. Oh my goodness.
It's
So many big words.
Yeah,
I wanted to really start with you about your background and just hear a little bit about your journey and how you came to develop the rapid health restoration system.
Okay. I'll tell you, many years ago, when I was a teenager, my mother had a serious discussion with me. I was about 15, and she said, "It's time for you pick something to do in life: doctor, dentist, lawyer." And I was like, she goes, "Pick one," and that was it. So I went to a chiropractor, helped my brother with his back pain. Long story short, I went to chiropractic school. I came out, and I just realized that it was only one tool that I had in my toolbox, and it wasn't enough to help somebody who had, let's say, endometriosis. It wasn't helping a woman get over a painful period. It wasn't helping somebody get over anxiety or asthma. And so I decided to go back to school. And it's too important for me to be able to help a person. I've got to be that Sherlock Holmes. I'm just that driven that way to find the answer and get the person the relief. And so that's how it all started.
Amazing. I like that your mom provided you with three options and three options only.
Yeah, that was it. Pick one. Like, what do I do?
Three lucrative careers.
Yeah, well, they could be. I'll tell
They
you
could
what, they
be.
can be, but
That's true.
sometimes people don't do well. And it's just, for me, it's again, I'm so passionate about just figuring it out and seeing somebody get their life back. It's one of the best rewards ever. It's a great thing to be, spending time, we all do on this planet. It's like, why not do something that's really worthwhile and helping somebody else get their life back? It's a great reward.
Truly, I couldn't agree with you more. I feel very much the same with my own work. And when you have these results, it's just really motivating to keep you going. And that actually brings me to your background again, because I'm curious, did you have any health issues at all, or was this just something that you went into because of, what you just described?
What I do now? What I
Yeah.
do now is that,
Yeah.
it was just years ago with chiropractic, and I'm not knocking chiropractic. It's just that there were people I couldn't help. I mean, somebody came in with a terrible headache and they got a chiropractic adjustment. All of a sudden the headache went away. But there were those people where the headache didn't go away, no matter how many times we treated them, or somebody who had leg pain and back pain and it wouldn't go away, no matter how many times we treated them. And then my mother, she's 70, I think she's 76, 75 or 76, but she had a heart attack, a quadruple bypass. And after that, then all of a sudden she got neuropathy, numbness in her legs and feet, and just it was just, I've got so many different stories of what I was seeing around me. But when that started happening, and there was nothing I could do for her at that time with my skill set back then and the knowledge I had. And even going further back, my grandmother, who I love dearly, she makes you rest in peace, but she She lived to 99 years old. She had just great genetics. How she did, incredible. But uh, her second husband, because my grandfather, he had a stroke when I was a little boy. He passed away when I was very young. She got remarried and they had a great 15 years, but he developed Parkinson's. And in 3 years after diagnosis, with the top doctors and the top therapists and the best medication, as they called it, he withered away and he was over. It was terrible to watch that happen. And there were other people around me with cancer happen, ovarian cancer with somebody who was a beautiful woman. She was like one of my best friend's mothers, had just surgery and chemo, and it just failed. It failed. And somebody else had lupus. And I was seeing all these diseases come up around me. And I was like, wow, I knew that person died, and that person. I was like, what is going on here? Because it wasn't that chiropractic wasn't enough, which it wasn't, but it was just that even the medical community was not, they just didn't have the effective for every person, at least around me in my life. It wasn't effective. And I mean, they saved my mother who had a heart attack and a quadruple bypass, but she was worse after, still with other symptoms. So those experiences, it just really for me, it was, I got to get the answer. I got to get the answer for people. It drove me to go back to school for more education, and I can get into that education. But it's just like, I'm here. I've already, I'm already involved in healthcare. Why not just be the best that I can be and really get results for people? And that's what it was.
And yes, and here you are, thankfully.
Mhm.
I know, I
Thank
feel
you.
like it's either you have your own personal health experience or it's people around you that drive you to do this. And I'm so grateful for all the people like you who do this, because that's why we have such amazing technology and all of these other things that we can now explore for our health. And so, like I said, still don't really know anything about quantum resonance. And I would love for you to explain that and just talk a little bit about how it relates to our health and wellness.
Sure. Well, quantum will use just there's a quantum medicine, it's called out there. There's other practitioners not doing exactly what I do, but it's just working on another level of understanding the energies of the body and the energies of the environment. And everything is energy. I mean, if you go back to listen to Albert Einstein, I mean, it's energy. It's just, you can't create or destroy, right? And energy, we can transition from one, physical energy, our body, once we pass, and then energy just leaves the body. It goes somewhere, however it transforms, whatever it transforms into, but it's always energy. And years ago, when that woman I told you about with the ovarian cancer, when she passed, and it was horrible, there was a course that was offered that I attended on alternative cancer. I won't call it treatments. We're not treating cancer, but it was alternative and another way of looking at the human body, where these medical doctors that started an alternative cancer kind of, if we can say, therapy type of school, they were talking about that there were different things that were driving the cancers. And when we can use different methods of, if we can say, therapy or modalities for the person, then they probably have a better chance of surviving and ridding the cancer. Because it's not, even with medicine, it's a 50-50 with chemo or surgery or radiation. And I'm not knocking what they do at all. I'm just saying that there's some people need and want the alternatives, because what if the 50% for that person is not going to work with that medicine? So back to the quantum understanding is that, because I started looking at, there was a documentary I'd seen years ago, What the Bleep? You ever see that one?
Yep.
So that was on quantum level. There was like all this discussion, quantum physics in there. And I just said, wow, there's something I didn't understand at all. I was far away. That was like back in 2005, maybe, when I saw that. And it was way before I decided to go back to school. But on a quantum level, what we understand is that there's two things I'm going to say, is that in my immunology studies, which is part of what I did in postgraduate immunology, the immunologists pointed out to us with research papers from journals all around the world that were not funded by drug companies. These studies, these were by physicians who were scientists who are looking for what is driving the disease, and whether it's rheumatoid arthritis, or it's Hashimoto's thyroid, or it's an ovarian cyst, or it's endometriosis, and the list goes on of different diseases. They were showing that with biopsy samples of tissues of the human body, they were showing that there were infections that were embedded in these tissues, and toxins even. Let's say a Hashimoto's thyroid came from a mercury filling in somebody's tooth. The mercury seeped from the thyroid from the tooth all the way down to the thyroid gland and made the thyroid sick. And now there's an immune attack against the mercury in the thyroid was the idea. I'm going to get to the quantum answer in a second.
This.
Just
I love it.
And then
Keep going.
there was like, yeah, there were, thank you. And there were studies about rheumatoid arthritis that we had seen where there were infections in the joints. They found infections in the gums of these patients, parasitic infections, and they found the same infection in the joints. And they came out with a conclusive answer that it was the parasite that was in the gums. It wasn't worms in the mouth. We're talking microscopic organisms, but the same organism was in the joints and it was making the joint inflammation happen, called rheumatoid arthritis. They even found it in the arteries, and they said it was arteriosclerosis was caused by the parasitic infection that was in the artery lining. So I remember, and I can go on a lot of studies, but I called the immunologist after I was done with that neurochemistry and neuroimmunology program. I called him up to thank him for opening my mind and opening my eyes to realize that there's a real true cause of the disease. Because at that time I had gotten into functional medicine.
Yeah.
You know about that? And I was running different labs and genetic studies and stool tests and many different labs, but there were too many people where I was running these different laboratories and there was no confirmation of anything causing their symptom. There was none. There was no virus or something in the blood. There was no heavy metals, a little bit in the hair or the urine. There was just no answer. And I was like, why did that person have a numb leg? I don't understand what's going on. So anyway, I called that immunologist. I thanked him for sharing the information. And I said, but all these laboratories that we're learning to run in this functional medicine, strategy or a series of tests, how am I going to find the mercury on the thyroid that you pointed out from the tooth? How am I going to find that? I can't take a biopsy of somebody's thyroid and send it off to a laboratory. He said, no, you're not. You're right. You're not. And no, you're not going to find it in all the labs you're running. I said, because I could run a hair heavy metal or a urine heavy metal analysis, but it's not going to tell me the mercury in the thyroid. How am I going to find that? And he said, I don't have an answer for you, but now you know the truth. Now go on your journey to find it. And I got off that call like, I was so excited to talk to him and thank him. And then I was all depressed.
It's like, what's next?
What do I do now?
Right.
And so I went on this journey of, again, then the cancer school. And I learned, and I'll tell you, I thought that many years ago, because I was so medical, I shouldn't say medical, I was just like getting into that rhythm of like running labs. That's the way to find it, the American Medical Association type of, the way of analyzing the body. And when I saw with this cancer school, I saw that they were talking about kinesiology, muscle testing, and I was like, that's bull. So anyway, somebody did it to me, and I was in shock to feel the weakness that was not there a second ago in my body. And I'm, what the hell is this? So then I just went on a journey. Let me learn about that. I immediately started taking courses, and I saw some pretty interesting outcomes with that. But now, fast forwarding to this, I found this work that was developed by biophysicists, where we actually have frequencies, we have samples of these different body parts. So let's just say, for example, I have a vial that's got the perfect energy of the perfect healthy ovary. And then I've got another vial that's got the perfect energy frequency of the perfect healthy. And I can go on much longer discussion. I'm trying to get right to the point here, because this was found by biophysicists. They found that every single part of the human body has its own individual frequency. So an ovary is not a fallopian tube. A fallopian tube is not the endometrium. The endometrium is not the cervix. The cervix is not the colon, is not the rectum, it's not the heart, it's not the mitral valve. It's not, you understand, different parts of the body. What these biophysicists discovered with using their measuring devices, they were able to measure the frequency of the specific body part. Now let's go to infections. There's a strep bacteria. There's different kinds of strep bacteria. There's staph bacteria. There's E. coli bacteria, there's gonorrhea, there's syphilis, there's chlamydia, there's many tetanus bacteria, there's many different kinds of botulinum bacteria, there's many different kinds of bacteria. Even though they're under the same family of bacteria, these different organisms, they have their own name. What these biophysicists discovered is that they have their own frequency, a frequency like a radio station on an FM dial. 103.5 plays certain music and 105.9 plays different music. One's a country station, one's a rap music station, for example. So what the scientists discovered is that they can actually measure the perfect frequency of that part of the body. They were able to store it in these vials. And when we're doing this work, and the same goes for infections and the same goes for toxins, gold is not mercury, mercury is not lead, lead is not arsenic. And all of those heavy metals are not glyphosate weed killer spray. And glyphosate weed killer spray is not the same as penicillin, right? So the point is, from that immunology course, my mind became open to understanding that it's different infections and toxins that get into these parts of the body that make symptoms occur. So on a quantum level, what we're able to do is, and I can share with you, not right now, but I can share, there's a video that's a 30-second video, a black and white video under a camera of watching what took place in blood under a microscope, where they put the frequency, the identical frequency, into a cell they found infected by a certain parasite. And when they impose the frequency of that parasite, like cures like homeopathy talks about like cures like, when we take that frequency of that infection and present that frequency to the human body, wherever that infection exists, it's going to just neutralize that infection, and the symptom associated with that infection will disappear. Does that kind of make sense?
Oh, totally.
So if a parasite's 1 to 3.5 and we can make an identical frequency copy, let's say it's a parasite that's in the fallopian tube, I'm able to make with my lab, we're able to make a remedy, a quantum energized formula, we'll call it now, of the fallopian tube, perfect healthy fallopian tube frequency. And we found a parasite with my exam. I found it's a tapeworm that's in the, so we can make the frequency perfect identical copy of that tapeworm. Let's say a woman's doubled over in pain and she's hurting terribly and it's such a painful period, and that lasts for 2 more weeks. So she's in bed for 2 weeks, she's up trying to work for 2 weeks, but always a fear because she knows once the bleeding starts, she's going to be in bed for 2 weeks again, and goes through this rhythm, the cycle for years in her life. And I find that it's the tapeworm that's in the fallopian tube. We make a remedy, identical copy of the fallopian tube and of the tapeworm, mix them together. We call it a hybrid remedy. The fallopian tube plus the tapeworm. I'm not putting the tapeworm in water or something. I'm making the frequencies embed with these machines that we have. So now when the person puts 1 drop of that liquid remedy or quantum energized formula in their mouth, on such an incredibly deep level, it's going to go right there, right to that tissue, and just get that parasite out of there. Whether it takes a day or it takes a minute or it takes 2 days, the symptom is just going to be alleviated completely with no other help. It didn't take a diet. It didn't take a supplement. It didn't take a therapy. It didn't take a hot sauna detox thing. It didn't take anything else. Just take that liquid drop, and then the symptom that was associated to that infection is going to disappear.
And the time frame? What are we talking about here? Something like that, what you just described. Yeah, like the things, the symptoms disappearing or the underlying cause being,
I'll tell you,
killed off.
Yeah, so great question. I'll say that it varies.
Yeah,
it varies. So let's just say Sue comes in and she's got that terrible pain during her period, and let's say she bleeds for 3 to 5 days, and then it's really bad, and then she gets a headache during the 3 to 5 days, and then and clots a lot, clots are coming out. And then after the 5th day, those symptoms really disappear. Another woman is painful all month. She's bleeding constantly throughout the month, and that happens. And let's say that Sue, the first one, and she takes 2 or 3 remedies to get rid of the infections that we found in the uterus and we found in the ovary and the fallopian tube. And within the first week, and she notices by the next time she has the period, there's no more painful PMS. There's no more PMS. There's no more painful period, and the clotting stops. And the headaches don't even return. And now months into the future, she's still telling me, reporting to me, I feel fine. Everything is fine. I never had a symptom return. But now let's just say it's Joan, who was the other one with the excessive bleeding and clotting and all the pain and all that. That's month, 2 weeks out of the month, 3 weeks out of the month, the whole month. And she's got endometriosis. It might take 1 or 2 or 3 or 4 different rounds of protocols, because there's so many different things. She's got candida in the uterus. She's got candida in her fallopian tube. She's got candida that's in her ovary. She's got HPV that's in her cervix. She's got candida in her vaginal area that we find with this exam. We can diagnose anything in any tissue. She's also got mold in all these tissues. She's got viral infections in the brain. She's got mercury in the fallopian tube. She's got mercury that's in the ovary. She's got, you understand? I can add on and add on. She's got strep bacteria and staph bacteria. And every time that Joan is with her husband or boyfriend or fiance, and he doesn't realize that because he doesn't have any herpes sores, he doesn't have any kind of oozing, he has no symptoms, but I'll be direct here, his semen, he's got staph infection, and he has no idea. He has no symptoms, no swelling, no itching, no rash, no nothing, and he's got some staph infection. So every time they have intimate relations, he keeps planting that staph infection in her. Right. And so it continuously causes more exacerbation, if not even promoting or provoking, but constantly is, making her hurt. So sometimes we've got to actually do that. We've got to be able to treat the spouse or significant other, And even when it comes to women with these, whether they're constant chronic bladder disorders, whether it's chronic UTIs or it's interstitial cystitis, which we're very effective and very successful with. Watch one of the testimonials I just put up. I mean, what we did for this woman, Cindy, is like just, she has a new life. And we're getting a second video from her because she's 100%, 23 years of suffering since she's 8 years old, debilitating bladder pain. And she goes on and talks about it in there. She was in tears talking about it. And anxiety and depression and no intimate relations and insomnia was it just her life for 23 years of her life. She's 31, was living hell. And in one treatment with me, and she'd been to, I think, over 40 doctors over the years.
I'm
She
sure.
had surgery that made her go from a 10 in severity to a 20. It was worse with a top doctor in a top university here in South Florida, supposed top, self-proclaimed top. But anyway, all the pain is gone, all of it. She's 100%. First protocol, 80% better, 100% life back. Now she's 100% better. All the symptoms are gone. 23 years of suffering. So, and when I say quantum level, I'll tell you what, 7 months of work, which was simple to follow, is a lot better than 23 years. It's fast.
Oh, no kidding.
But we've seen people with all kinds of symptoms. It could be, I forgot what your question was. I'm sorry, I went off on a tangent here, but I love doing the work because when Joan, we have to, what I figured out is that I can actually, if the spouse or significant other is willing, I actually like to get a sample of the semen and run a study with it. And we're able to find, oh, that was staph infection that was in there, for example, or there's Epstein-Barr virus that he has in there too, where it came in, maybe it was from his prostate, wherever it came from. But every time that he's with her, he's injecting is maybe not the best way to put it, but he's implanting that Epstein-Barr in her, and it just keeps on fueling up this terrible storm that she has with her month-long period. Not to say he was the first to blame. She had the symptom before she met him, but now you understand? So I can actually, we can actually make an exact frequency copy of the semen. And I found that with women with bladder problems and with, cervix and all these inflammatory female reproductive tissue problems, we could find that exact combination of whatever it was. He had Epstein-Barr and he had mold and he had mercury in his semen, let's say, and that's in her. We can make a remedy of that semen and get it out of the tissue of her body to calm down the situation.
I mean, you've just completely blown my mind. There's so many questions. I think the first is, you mentioned all these different viruses, all the bacteria, all of these issues. Is this something that pretty much everyone deals with? Or is it that our health is just not what it used to be? So these problems are so much worse now. Like, what's going on here? Because tapeworms and fallopian tubes, this is not something I've ever heard.
Yeah. So, right. So, and it's not just tapeworms, but there's mold.
Oh, I'm
there's
sure.
candida and other fungal infections and bacteria and parasite, right? Yeah. So viral. So I think that for you and me, I think that we pay attention more now because this is what we do with our lives. So it's possible. And also social media, there's, there's more technology now that we're so connected to other people in the world now that we never had before, going back 30, 40, 50 years ago, 100 years ago. There was no connection this way. We were just depending on a newspaper or, whatever news on the TV was or the radio. And so there wasn't this incredible connection that we have now, which we do, right? So I think that we're much more aware of it. One, because people like you and me are paying attention to this. But two, yes, I do think that, and because of social media, but two, I believe that there's a lot more going on in the world now than ever before, right? There's more surgical procedures being done. There's Botox injections that are poisoning the body. There's vaccines that are just like raised to the most ridiculous degree of called vaccines, these shots, these poisonous shots that they're putting into people. And even more in the past 3 years, COVID introduced into the world, COVID shots introduced into the world. Whatever people think and whatever they want to be pro or anti the shot, there are symptoms that are developing from these shots in some people, not everyone. And hopefully others who don't have a symptom, they never will get a symptom. So, but for COVID being out there and different strains of COVID, it's affecting people in the worst way. I just think that there's more pesticides in the environment now. There's weed killer spray that's in the environment now. There's just so much. There's just so much that's going on. And I believe that we've got certain physicians in the healthcare community who only will throw antibiotics at people no matter what. They don't even have a lab result yet, and they're throwing antibiotics at people. It's just a constant thing. So there's just so much that's building up in the body, and it's leading to these various symptoms. But there's also genetically modified foods. There's a long list, right? About diet. And there's more chemicals in the environment from different fragrances and different smells and the things that people plug into their homes, and even essential oils are hurting people, quite honestly. I found that out recently. But it's even these different air fresheners. I mean, it's just people are hurting because there's too much stimulus in the environment. People, I think, and there's too much EMF, if you know about that topic. So we got the cell
Yes.
phones, we got Wi-Fi, we got 5G towers, and it just keeps building up. So there's a way to counteract all these things that I've discovered. And
Right.
but yeah, I think
So
that
it's
there's
like a
more
massive
disease now than
exposure
before.
issue, essentially, that's weakened us to the point where we
Yeah.
couldn't even fight against half of these things if we wanted to.
Well, we can
Well, we
with the
can,
right help.
yes.
We can with the
Yes.
right strategy. And
Right.
so we can't. It's just without the right strategy. Yeah, we are really humans have set other human beings up for not a good thing, and also, for not a good defense against what's going on in the environment. And there's even research now, at least stories that I see online, and I don't know if it's all propaganda or not, because that's another hard thing to deal with right now. Is it real or not real information? But they're genetically modifying mosquitoes. When a mosquito bites a person, it's not that it's a blood sucker and it bits you to suck your blood. I'm not saying it's not a vampire in that way. I'm just saying that the mosquito transmits disease.
Yeah.
So people can get malaria in any country in the world, not just in the Amazon jungle. And there's viral infections from these mosquitoes. Whether a person feels sick immediately, like some studies have shown that they got dengue fever, or they got whatever, West Nile
Chikungunya and all the
virus,
rest of it.
or
Yeah.
chikungunya. Yeah, it
Yeah.
happens
So
here in the
many of
U.S.
them.
Here in the U.S., malaria. There was a man who came to me. He had nerve pain all over his body for 8 months. He felt like he was dying. His heart rate resting in bed was 120 beats a minute. Resting in bed, 120 beats a minute. And he felt like he was walking on broken glass. I have a video of him with his mother. After his first treatment, all the symptoms went away with my care. He lived in Virginia, never left there ever. Lived at home, 30-year-old, 30, 31, whatever, living with his mother. Never left home ever. I mean, school, work, but never left the country, never went anywhere else. What did I find with him? It was malaria. He had
Wow.
malaria in him. How did he get that? Mosquitoes can fly around and transmit disease. So when they bite us, they're injecting things into us. So
And I
there's so
imagine
many
we're not
different ways.
testing for malaria in Virginia,
Yeah.
right?
When are
Because
they
it's
doing
not
that?
like the
Right.
first,
And they're not
yeah,
even,
the first
I mean,
line of
they just said
defense.
that it's in Florida and people are accusing Bill Gates, and we don't have to go there, but yeah, I
Yes.
think so. But
Oh
anyway,
my God. I know, right?
that's another story, right?
Oh, it's a whole other story, a whole other podcast.
Yeah.
Okay, so talk to me a little bit about the various types of quantum resonance exams that you have, because I see that you have a couple of different ones on your website. Can you just describe them and how they help? I know you kind of talked about like how it helps to uncover these underlying health issues, but I'm so curious about which ones you use, or do you do all of them on someone, or does it depend on their symptoms?
Yeah. Another great question. Thank you for asking that. I'll tell you, when it comes to the emotional exam that I do, and I've left that as something that they can choose separate. It's an option. And because the other exams, the other quantum exams that I'm doing, that I developed all these different skills with this, these methods, these strategies, I realized that there are different environmental stimuli. I'll get to the emotion in a moment, but the environmental stimuli, there's different fragrances. I don't talk about it too deep on my website, but there's different fragrances that are bothering people. There are some people who could smell the perfume and feel fine and just like the smell of the perfume. There are some people who smell the perfume and they say, oh my God, I feel like I've got a headache immediately after I smell the perfume. My head is pounding. And there's somebody else who smells the perfume and doesn't realize that an hour later they had stomach pain, and they think it was from the food that they ate at lunch, but it was from the perfume, that it took a delayed onset trigger. There was already infection that was in their stomach, but when they smelled the perfume, it made that happen, or made their bladder hurt, or something else hurt. So there's different environmental stimuli that I realized to use. One, fragrances in my testing, because I can find that the person, for example, they smell the perfume and it was because there was a parasite in their stomach that made them hurt from the perfume, for example. And I can go on mold in the brain or whatever it is. I found with different foods and I used to run these different functional medicine food sensitivity tests, and I gave up on that for various reasons. But one is I'm able to find with my food analysis that I can just tell immediately in the exam if somebody's stressed by garlic, or they're stressed by cinnamon, or they're stressed by apple cider vinegar. That's supposed to be the greatest cure-all of all things. People are stressed by the smell of it, and people are stressed by tasting it. It's incredible what I've seen. So chocolate or meat or chicken or tomato, and the long list, salt, even pink Himalayan salt, can be hurting a person. So we're able to find what these different with the food analysis I do, it takes a long description. It takes a long time to describe how I do it, but I can find what I've discovered is that the foods are not the problem. Organic is better than GMO. Don't do GMO. But even with an organic tomato, somebody may have a symptom. Maybe they throw up every time they have an organic tomato. And what we're able to find, it was linked to mold that was in their stomach, for example. We get rid of the mold from the stomach, they don't have the reaction to the tomato anymore.
Right.
And the same
Which
goes
makes
with any
sense,
other
right?
symptom.
It's usually not the food, it's usually what's going on in the body.
Correct.
Yeah.
And the same for the smells, but it's also, we have stimulus from sounds. We have stimulus from the news, the people that we see that we don't, really agree with, that can bother politically or something else. And there are even vision, even light stimulus, not just watching somebody you don't like on the news, for example, but even just light entering the eye. I mean, you could just look at your phone. So I learned in neurology that there's different stimuli, like example, just light entering the pupil can stress a person. And what I realized from the immunology program is that, let's say there's a virus that's in the brain, and every time the person opens their eyes, they don't have a headache when they're sleeping, and they sleep really well. But once they open their eyes and they see the daylight, boom, it causes that Epstein-Barr virus that's in the brain to ignite, and now they got headaches all day, but they're able to sleep at night. So, and the headache is not there at night, only when the light hits their eye. But they don't realize this, and the doctors that there's MRI and CAT scan, they don't get it. But when we find that connection with the light, and then there's even movements, even with the different stimuli of somebody on their cell phone when they're like scrolling through Facebook, and the way that the things move up and down that vertical pattern, the way that the patterns enter the brain through the eye literally can cause stress in parts of the brain and make symptoms occur. And it's because, again, that there's infections and toxins that got into the body that made the tissues of the brain and the body weak. So these different stimuli, whether they're watching Netflix and scrolling horizontally with their different, thumbnails to pick a movie to watch, or vertically on YouTube or vertically on Facebook, those stimuli are hurting people. But then there's also physical movements. There could be let's just say a woman has an inflamed cervix, and she's got her ovaries are hurting her, and she's got cysts on the ovaries, and she's got endometriosis, and she's got painful periods, and she's got foot pain and back pain and leg pain and body pain, and the list goes on, and heart rate problems and digestive problems. And I find that while she's lying down in the exam, covered, very professional, always very professional, she's lying down on the exam table, and I can't find stress in her body. But once she goes to do a sit-up, I find the body breaks down and gets weak. So even just physical movements can cause a certain reaction that I can measure with the method that I've developed here over the past 10 years. And I found that it's because when she sits up, the body got weak, because, and I'm able to diagnose, it's because she has candida in her endometrium. She's got candida in the fallopian tubes. She's got candida in the ovaries. When she's holding on to the equipment that we have, no computer, no electronics at all, when she's holding on to this metal equipment, I talk about this in let me pause for a moment. I'll come back to that scenario in a moment. If you go on my website, there's an ebook that's free to download. And on the last page of the ebook, I have a video. It's old. It's probably about 5 or so years old. I could update it. But in any event, I give a pretty good description of first half of that 40-minute video. First half is me talking about my journey as a physician. Second half, I'm giving people an insight of how I'm able to find these things, how with the equipment that I'm using to diagnose what I'm saying, like endometrium candida, ovary candida, fallopian tube candida, and so on. So anyway, when she's holding on to, back to this, when she's holding on to the equipment, again, she did a sit-up. I measured the body became stressed by sitting up. And I found that it's the endometrium with a lot of candida, the fallopian tube with the candida, and the ovary. That's repeating what I said before. I don't remember exactly the example I gave you before, but let's just say it's candida in all three of those tissues. When she's holding onto this equipment, the body feeling the frequency of the endometrium, and as if the candida left the endometrium already, and the frequency of the perfect healthy ovary as if the candida left the ovary already, and the frequency of the fallopian tube as if the candida left the fallopian tube already, without even taking the remedy that we're going to make in the laboratory. So when she's holding on the equipment, her body's going to present to me as if those infections are gone from those three parts of her body. So she lays down again and she sits up, and I don't measure the stress reaction anymore. So the reason why, and she didn't realize that every time she's laying down, she could feel fine. But when she goes to get up, all of a sudden it's unbearable pain, and she just wants to, hunch over and cry in pain because it's so painful.
Right.
And I find that it's because of the candida with that step. So now when she lays down and sits up again, there's no more stress that we can observe because the body's gotten presenting to me as if those infections are gone, if that makes sense how I'm describing that.
Yeah.
So, and I can go deeper and deeper and deeper. There's so many different exam strategies from a physical standpoint of the function of the human body, not just, as I said before, I'll get to the emotion in a moment, but in addition to the food way of testing and the environmental stimuli, but the fragrances, teeth, I'll mention, but my dental exam, there are times that they go to their dentist, they get a cleaning every 6 months, they get an x-ray checkup every 6 months, and they think everything is fine. They had a cavity filling. Let's just say that a woman went to the dentist. I'm going to make 2 points here about dental work, is that let's say she went to the dentist and everything looks fine. They can't find an infection. They fill the cavity, but they don't see anything else wrong. They give them the great, approval. And so after they did the cavity filling, it was about 3 weeks later, she's all of a sudden, it just started. She'd never had period problems before, or PMS problems ever in her whole life. Now, all of a sudden, she's fatigued 3 weeks after but doesn't realize the dental thing, the connection. She's fatigued and she's got unbearable abdominal pain as she starts her cycle, as she starts bleeding. How did that happen? And she goes to her OBGYN, and then that OBGYN can't help her. They run tests and they can't help. And so, long story, she goes to the emergency room, she gets different tests done, and she has ultrasounds done, a yada, an MRI, and they can't find anything wrong. And then somehow she stumbles upon me, and I say, oh, that dental anesthetic is in your uterus, and it's in your lymph, and it's in your brain. And now we get rid of it. And now guess what happens? All that pain that started 3 weeks after the dental work, she never knew the connection, but we get rid of that chemical that got deeply embedded into those tissues, and all the symptom goes away. And that fast. So with the dental work, one is that there are times that people, back to that, is that people have infections that won't show up on dental x-rays. So one thing I do is I have a dentist who I send people to. We check with a CT scan, because CT scan can find if there's an infection in the jaw or tooth where it's not noticed with an x-ray. Yeah. And then there are teeth like root canal teeth that are carrying infections, and dead energy that's migrating down to an organ.
Or like so when you had a wisdom tooth removed and you have a cavitation or something,
you can
like
have that too,
right?
Absolutely. Yeah. So, but sometimes the dentist misses that because the x-ray won't show it, but the CT scan can. So the dental exam is really important.
Like with a biological dentist, I imagine, right? Because that's been my experience.
My dental exam that I'm saying, a biological dentist, but yes, with biological to a certain degree, they still got to numb them out. They still have to do something.
Well, yeah, but someone who specializes in more of a holistic approach to dentistry.
Yeah, you're right. Yeah. And I found, and I've got some examples on my dental page showing pictures of where there was infection underneath a crown, but the dentist, like, how the hell did you find that? I couldn't see it. So anyway, back to that. But the emotional test, I've realized that there are certain physical symptoms, like, for example, that a woman has a problem with her period. She's got a problem. She's hurting terribly, and she has endometriosis. Let's go with this. And she had a DNC, and the pain came back. And the pain was gone for a couple of months, but the pain came back. And she's at her wit's end. And I find in my history taking that she was physically and emotionally abused as a little girl, and that left a deep impression in that brain. And that deep impression in the brain, sorry for that, somebody came in my room, and the deep impression in her brain, that environmental stimuli, because in epigenetics, they talk about it's not the gene that caused the symptom in the person. Like a breast cancer gene doesn't mean they're going to get breast cancer. In epigenetics, they proved that it's not the gene, but it's the cell that becomes diseased caused by the environmental stimuli. And emotions are an environmental stimulus. So even there was a Dr. Masaru Emoto, a Japanese, I think it was Japanese, he passed recently, but he proved with water, which makes up about 85% of our body, right? So he proved that water, under a microscope, he was able to prove that the emotion, the word spoken to or thought of over that water, can make the water look like a beautiful snowflake when he froze it, or it made it look like a disgusting, just like a muddy looking thing. Have you ever seen that work?
I've seen it. It's incredible. I think he exposed it to, I think it was
love,
like
hate,
Beethoven,
evil.
And like
beautiful.
really aggressive rap music or something like that.
And even heavy metal, and how dirty it looked. Beethoven looked beautiful. Or saying the word angel, it looked like an angel, like a halo, and then evil, it looked like just muddy, dirty, with the same water, just changed.
Yeah.
So think of the emotions that we have, that we deal with on a day-to-day basis. The water, which makes up our cells and our tissues of our body, we got to stay hydrated. think of that cellular change that's taking place because of the emotion that's deeply embedded into that tissue. So, right, could you imagine, for just think of this, when a woman was physically and emotionally abused as growing up, and she cried and she has horrible memories about what happened to her. um men can be terrible. Even sometimes women,
Yes.
mothers, can be very neglectful too. I'm not blaming all men, but men do terrible things to kids. I won't go further about that, but it's I've seen where, like, endometriosis in a woman
Mm-hmm.
was really and first of all, endometriosis uh, is triggered by infections that are in the tissues. Period. There's no just some strange genetic thing that's going on. It's not just some alien life form that just got into their body. It's infections that got into the endometrium, and that's it's just like having a. If you ever seen like psoriasis, for example, the skin
Yeah.
changes.
Yeah.
Okay, so think of psoriasis is caused by infection. They say autoimmune disease, there's inflammation. I get it, but it's infection driven. Get rid of the infections and the inflammation goes away and the rash goes away. And I've got proof of this. I've got proof of this. I've got a whole skin playlist, skin disease page on my website, skin disease playlist on my YouTube channel that people can see the before and after. Is just outstanding what we've done for people. So think of the measles. Now let's go with psoriasis. Think of the measles. Somebody has the measles or chickenpox. What happens to the skin? It doesn't look too good, and babies cry with it, right? So imagine the measles never left, even though you had the MMR vaccine, and the measles are still in your body, and it implants itself into the endometrium.
Mm-hmm.
What's going to happen to that tissue? Is it going to look good, or is it going to look
No,
like the skin did as a baby, rashed?
absolutely. It'll be
Yeah,
deformed for sure.
yeah, it'll be
Yeah.
deformed. So endometriosis, whether it's the
Right.
measles or it's staph infection or strep infection or all the above, and I can go on a long list. And let's say that measles is spreading from the endometrium to also the fallopian tube and to the cervix. And it goes through the bloodstream and it goes to the muscle in the body and it goes to the lungs. What are those tissues going to look like? The same thing as the endometrium change, right? The endometriosis. So when the doctors say, because there are different types of endometriosis, where I shouldn't say different types, but they'll say you can read online where it spread to different parts of the body. It wasn't just in the uterus. It went to different parts of the body. How did it do that? It's not an endometriosis alien life form. It's infections that have now migrated to different parts of the body that make the tissues look identical between the endometrial changes to the fallopian tube, to the ovary, to the wherever it went. That's what it is. If
Yeah.
somebody had a strep throat, they get a swollen, sore, throat. It's hard to swallow. The function of the throat goes down, as well as the swelling that's obvious there. It's red. It might be pussy and painful. What if that strep is in the endometrium? What if they took an antibiotic to get rid of the strep throat and the strep throat symptom went away, but that bug, it changed its structure. It became an antibiotic resistant version of itself and it went down into another part of the body. So it's not noticed. They're smart, these bugs. And it went to the
Yeah.
endometrium. And now it's sort of making her have a strep infection appearing endometrium. You understand?
Mm-hmm.
So again, back to the endometriosis, I forgot where I was before I went off on this tangent, but when we can find these things and rid them from the body, those symptoms just disappear. And I've got proof. There's a woman we did with endometriosis. There's a video I have on my YouTube channel. Remarkable. You hear her just like pouring her heart out to people. Listen to what Dr. Herman is doing. She suffered since she was a kid for decades. She suffered terribly. And I think for her, it was like 3 weeks out of the month of misery, not being able to function and get out of bed, and horrible. And I think that was by her second protocol with me that she was able to work. She was able to go out. She was able to enjoy life. She didn't have the pain. So I forgot where I was, how I got into this tangent.
Well,
Excuse me, but
I was just going to say I'm glad that you brought up endometriosis and that you believe that the underlying causes or the driving factors are these underlying infections and various other things, because I wanted to know, and I also feel like there's obviously something driving this, and of course Western medicine is not looking at it from that perspective at all, which is really frustrating, especially because there are millions and millions of women struggling with this. So I appreciate your perspective on that. And I was curious from you, what does a session look like? How does this all work? Does someone come in and what does the machine look like? I'm just so curious about how a session goes.
on an average, back to the emotion. That's where I was going.
Oh, the
Let me go back to
emotions.
that.
Yes.
That's where I was.
Okay.
That's where I was. Now you're thinking of the, okay. So I find that it's the emotional trigger, I'll get to your question in just a moment.
Yeah,
You might have to remind me because I get so
that's
I'm on a
fine.
tangent with this. But the emotional test, what I discovered is that while somebody might have anxiety and they might have depression or both, one or the other or both, and we can literally change that. And I've got proof. I've got great testimonials from people, women especially, who've gone through years of depression, gone through years of anxiety, where it's just fixed with this work now. But even more than that, what if they don't have anxiety or depression? What if the depression is only because their bladder and their uterus is in pain all the time? And if they can just rid that pain, then the depression will leave. They're just depressed because doctors can't fix them and they're suffering all the time with that pain. So I find, though, that when the woman as a girl was physically and emotionally abused by somebody around her, and that triggered now a cellular change. Let's say there was a dormant virus that was in her body that was part of her genetic makeup. The virus, we have viral genes, and the viral genetic makeup was there of Epstein-Barr that was dormant. And now the physical and emotional abuse ignited that Epstein-Barr virus. And now the Epstein-Barr virus has been running rampant in her body for decades. And I find that when we go into this emotional exam step, and I find that it was her, whatever, her uncle did this to her when she was 5 years old. And now she's got to go through this whole series of statements that ever make, and the forgiving the uncle and certain things about, I won't get into all the details about it, but I'm able to find that it was the Epstein-Barr virus that was triggered. It's in her uterus, it's in her endometrium, it's in her ovary, it's in her brain, it's in her heart, it's in her thyroid, it's in her lymph. And now we can neutralize that. So the emotion triggered that bug, call it a bug, called it germ and virus, to now wreak havoc in her body and make her have the endo symptoms or make her have painful periods. And when we can now link the emotion to that virus and now neutralize it with the protocol that would develop for her, then it will literally get her to finally forgive the jerk who did that to her. But B, literally, it will make her do that so simply on a quantum level. But it'll also get rid of the pain that she's been dealing with in her reproductive system. And now she can have normal periods and she doesn't have the pain. Whether it takes one treatment or two or three, I don't know how much is causing it. Everybody's different. So it's got to be individualized. My
So,
exam.
question for you really quickly on that.
Yeah.
So, I imagine that is part of why endometriosis is so strongly linked to childhood abuse, particularly childhood sexual abuse.
Sure. I don't know that stat, but yeah.
Yeah, no,
Yeah.
it's pretty high.
I think about it. People have germs on their hands. So if
Yep.
he's just, he or whoever, just use their hands only, right? But we also have germs in our saliva. Who knows there are some people who are doing things to children. It's horrible. But also penetration. I mean, if there's any semen exchange, absolutely. There's germs. There's germs. So yeah, I agree with what you just said. But it's not all people who've been physically or emotionally abused
Oh,
who
yeah.
will have, right? They could have loving parents and there could have been a perfect growing up, but got sick.
Yep.
Got sick. And she could be 15 years old and have endometriosis, for example. And she's still a virgin.
Oh, yeah,
And
definitely.
there was no ever abuse of any kind. How did it happen?
Right.
Right. So again, what if she just had, a strep throat and constant ear infections as a little kid and took a lot of antibiotics? And now the antibiotics, the residues made candida grow in her body, and the candida got attached to the uterus and the ovaries and the fallopian tube. And the strep infection that was there morphed into an antibiotic resistant version of itself. And that went down to the uterus and just caused this whole thing. We're able to
Right.
find those things. So yeah, but definitely there's abuse that's got to be dealt with. So the emotional. What's an exam
Yeah.
with me? The
Yeah, I would love to
process I
know.
talk
Yeah.
about a little bit in that book. That's why I said about that video, because that would take about 20 or so minutes to describe it. I'm not trying to
Okay.
hide it. It's just that I
Oh,
don't
no,
know how
no.
your listeners have the time. Yeah.
No,
But
I was just curious for
yeah,
anyone who's listening, who's as excited about this as I
yeah,
am,
it's
what the
exciting.
process is like.
Thank you. Thank
Yeah.
you very much.
Yeah.
I love doing this work. It's fun.
I can tell.
Thank you. It's on an average, it's probably for a first day with the new patient, we have on an average about 5 hours that they're going to be in here.
Mm.
It's not exhaustive usually for them. For me, it is. It's a lot of work that I put into it. Um, yeah, but it's about a 5 hour, sometimes 4 hours, sometimes 6 hours. It just really depends on what's appearing with the patient. Um, and then they get a protocol that we develop for them that usually takes about 2 weeks to prepare for them in our lab that we ship to them.
Mhm.
whether they're local or they come from another state in the US or they come from another country. We have people from all over the world who find out about my work and come here. Literally from Israel, from Thailand, we've had Indonesia, we've had New Zealand, Norway, Netherlands, Romania, we've had all across United Kingdom and Ireland and Africa, Australia, Canada, Mexico coming in here. And I probably left out a few places, but so we ship them the
We get
protocol,
the
and
idea.
yeah, we ship them the protocol, and they follow the protocol, 3, 4, or 5 month protocol at home, and then we check on them periodically, or they can please, hopefully, they check in with us if there's something wrong or something good that's already happening. I want to know either way, not during the protocol, and then we see them again. Now, sometimes people are completely relieved from decades of symptoms in one protocol, and that's what I'm shooting for. The sooner that somebody's better, it's better for me, it's better for them, it's better for the whole world. Because what I'm after, the greed factor that I have to fulfill is I want more testimonials. The only way I can get a video testimonial to put it up online is to get the person better. I have to deliver the goods to them. So it's like somebody's training in gymnastics or their whole life ever since they're like 3 years old, and they just have this desire to win the gold medal in the Olympics. That's their ultimate thing. For me, these testimonials are my gold medal, and the only way I can get that gold medal, so to speak, is to give the person what they came to me for.
For sure.
And the sooner the better. So I'm always striving to, if it only takes one visit, let it be, because then I get another, more proof to show the world that I can help another person who needs help. I don't need it to take 2, 3, 4, 5, 6, 7 visits. I'd rather it be one and done. And that's what I'm always striving for. But I don't know, is there, it's like this analogy I give. If you're in a rowboat and there's 20 holes in the bottom, you patch up 1 or 2 or 3 of those holes, you're still going to sink. So some people have multiple different causes. We have to patch up all the holes, in other words. And there's no way for me to predict how long it's going to take, but we're shooting for the sooner the better. That's
Right.
it. That's what we're in it for.
And do you make recommendations around dietary
Yeah.
lifestyle changes as well, that I imagine would go in hand with what you're suggesting for them?
Yes.
Yeah.
Yeah. So there's a
Okay.
diet plan that we're going to make for them, which we'll only know when we do the study on them. So there's no
Right.
general speaking, stay away from nightshades and stay away from gluten or stay away from dairy. Because even staying away from the food, you still got to find what caused it and fix it. Because people can eat those foods again without having the symptom down the road. So there's going to be diet recommendation that we're going to know from our study that we do. There's going to be environmental stimuli recommendation as well, because if there's certain fragrances, whether it's from a perfume or it's from apple cider vinegar or it's from whatever it is that I find is it's also part of driving the problem, they have to stay away from those certain items as well. If there's news that's bothering them and also igniting makes them have headaches or makes them have whatever, so they're going to have to stay away from watching and listening to certain things if they want to get better faster.
Right.
They've got to play the part. Yeah.
Yeah.
So
Well,
there are some recommendations.
you mentioned other things like anxiety, depression, things like that. What about other behavioral issues like ADHD and
Absolutely
like
fixable.
addiction and all of that? Can we talk about that really
Yeah,
briefly?
fixable. I haven't dealt with addiction.
Okay.
So I'd love to, but I haven't dealt with that yet. And I believe that the addiction, bugs, parasites, for
Yeah.
example,
Yeah.
let me use an analogy before I give that answer. If you drove to my clinic, right, and I say, don't worry about it, leave your car running, leave the windows down, don't worry about it. Nobody's going to steal it. Everybody is on vacation. Everybody was mandatory to leave except me. It's just my staff and you in the clinic here. Nobody's going to steal your car. You park, you say, you sure? Don't worry about it. It's going to be there. I'll cover it. Here's the written paper. My insurance will cover if it's stolen. Okay. Don't worry about it. So you drive here, you leave your windows down, leave the car running, key in the ignition, car is running, right? You check the odometer, you get the reading. You've got 3,233 miles on it when you park. 5 hours later, you're done in my clinic. You go back out to your car's still sitting there, it's still running. And you look at the odometer, same mileage. Nobody got in and drove it and brought it back to you. It's still there. Nobody took it. Now you got like 3/4 of a gas tank. You came full and now it's just burned out through some of the gas. All right. You get in the car and you drive it. It's going to perform the way that you make it perform. You say, you know what, doc, why don't you drive? I'm tired. And I say, all right, get in. You're going to the airport. I'll drive you to the airport, which is a few minutes from here. So you get in, passenger seat. I get in and drive it. It's going to perform differently because I'm driving that car now. If my mother got in the car and she drove it, trust me, she drives a little bit different than you and me. So it's going to perform different. Same vehicle, but driving different. So think of with addiction, and behaviors. Think of behaviors like somebody's got sugar cravings and I can't, Dr. Herman, I don't care what you tell me, I'm good. I can't, my daughter can't stay away. My child can't stay away from eating sugar. It's so hard. They're autistic. They won't stop eating sugar. I get it. Okay. We find that the driver is the parasite in the brain, for example. Get rid of the parasite from the brain, and that sugar addiction or the whatever addiction is going to stop. So it's the bugs that will drive you to perform differently. Get rid of the bug. Me driving your car is going to make the car perform different than you driving a car. You understand what I mean by that?
Yeah.
So there's bugs that get in you, molds and candida and different things that drive you to behave and crave things different. Because guess what? Fungal infections crave sugar too. Mold infections crave sugar too. Everybody loves sugar.
Mm-hmm.
Parasites love sugar. Bacteria love sugar. Viral infections love sugar too. They're going to drive you to crave the sugar because they crave it too. So
Right.
when we
So
get
it's our
rid of the
underlying
bug,
infections craving the sugar, not us.
I mean, I still like sugar, but yeah,
Yes.
when you get rid of them, unless you got real super strong willpower and you can do it, get rid of the bugs and then you can get rid of the craving. So, but I
Amazing.
haven't worked with drug addiction yet. That's all I
Okay.
was saying before. I haven't done that.
Right.
And yeah. So I forgot your other question.
Oh, yeah, that was really it. Like drug or alcohol addiction, any kind of addiction
But
ultimately. But yeah.
ADD, ADHD, that type of thing. Yeah, we've seen
Mm-hmm.
that change. I've got some learning disorders I've just seen disappear. It was the bugs in the brain, the chemicals in the brain that trapped their brain, that they couldn't focus in class. Hyperactivities calm down, focus, going from
Incredible.
failing classes to not anymore. I mean, not being able to keep a job and now being able to, keep a job and thriving in life. We've seen incredible things happen. Brain fog disappear, focus problems disappear. It's incredible.
That's, yeah, incredible. Dr. Lonnie, thank you so much. You've completely blown me away. I'm so amazed by everything that you shared. I would love for you to just talk a little bit about where everyone can find you. I know you mentioned you have a YouTube channel as well. I'm sure that's full of great information.
Yeah, thank you for this offer. My website, maybe you can put the link underneath the show notes here.
Oh, we
Thank you. I
will.
won't have to spell it. My YouTube, my Facebook, Instagram, and again, they can download. There's 2 books right now. They can download one on my website to learn a bit more. And again, at the end of that book, I said earlier, at the end of the book, there's a link that takes them to a video where I describe about my work. And right now we just compiled, I think we're up to about 130 pages is the final draft, because about skin disease that I deal with that we're very, 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 very happy to say we're very successful with acne gone, completely gone. It wasn't hormones. It was bugs in the body. We got rid of the acne disappeared, which I prove in before and afters. Rashes from lupus gone, eczema gone. The youngest I worked with, he was 3 months old, baby with Down syndrome, had eczema. I found he was allergic to his mother's breast milk. Talk more about that. Talk about it in the video. So right now we just compiled, when I say we, I had somebody help author it form with me. There's so much that I'm doing. So I needed some help to, I compiled all the evidence, but the information, but to, put it into a well-written book. So that book, we're going to release it now in probably the next week or so. We're going to be ready with that one. So, but they can find me on my website and find me on social media. And if you put
Amazing.
those in the show notes, that'd be great.
Oh,
Thank you for that.
absolutely.
Thank
We
you for having
will.
me on. I really appreciate you for doing this.
Thank you so much. This was so enlightening. I really appreciate all of your knowledge and your commitment to helping people. It's really amazing. Thank you.
Thank you.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at nicolejardim.com/quiz.